So today we are talking about aging with vitality. So my plan is to spend just a wee bit addressing what is dementia, because that's what we want to reduce the risk of. And then we're going to also have some opportunities to challenge ourselves with some fun little puzzles I have. And then we'll talk about different ways that we can reduce our risk. So when you look at this picture, what do you see there? Just call out what you see. Okay, so some smarty ones at the front can see both pictures. So can everyone see both pictures, or some may only be able to see one depending on how our brain is working today? We're good? So there is the gentleman with glasses as well as the word liar. And here's a couple more. So these are some brain teasers, and they're actually very common phrases that you have all heard, you may all have used. So I'm just wondering if anyone can figure out what number 1 is. Nice and loud so everyone can hear it. It's a common phrase. I heard number 2, adding insult to injury. Yep. What about number 1? What's that? Oh, I still didn't hear you very well. You're close. A person after my own heart. Awesome. Thank you. Maybe I just didn't hear the first part. Okay, so what about number 3? Okay, what kind of fish? You're close. She said fish out of a pond. We're getting there. You got it. Big fish in a little pond. And do you see how that works? All right. And what about number 4? There's lots of them out there today. Potholes. Good job. All right. So those are just some fun little brain teasers, really just encouraging you to think outside the box in ways that you don't necessarily think. So what is dementia? This is a very common question that we receive in our office all the time. There's certainly a lot of misconception around Alzheimer's disease and dementia. So dementia really is the umbrella term of a set of symptoms. So those symptoms include that loss of memory, change in understanding, change in judgment, as well as our change in personality. And all of these things start to affect our functioning. So when our functioning level is changing, that's when we may receive that diagnosis. The functioning piece is a really important part of diagnosing dementia. So dementia can be reversible as well as irreversible, and we see both. We tend to see a lot more people in our office with an irreversible form of dementia, and they could be caused by any one of these numbers. So we look at sort of dementia as this umbrella category, and underneath it, all those different spokes of the umbrella are different forms of dementia. So Alzheimer's disease is a form of dementia. It is a progressive neurodegenerative disease. Mixed dementia is actually a combination of vascular dementia as well as Alzheimer's disease. It looks a little bit different when we see the symptoms, as well as there's very differences in the brain. So on Friday, I'm coming back and I'm spending a little bit more time talking about the different forms of dementia as well as some of the warning signs. Lewy body as well. Lewy body is another form of dementia. Again, it looks a little bit different with regards to symptoms. It often resembles some Parkinson's disease as well. There's some rigidity and balance changes that happen earlier than what we would see in some of the other forms of dementia. And then lastly, frontal temporal dementia is the last form I'm going to talk about. And again, this one for me is a bit scarier because it tends to happen for folks before 65. And their memory is fairly intact early on, but they certainly have some variety of changes with regards to their personality and decision-making abilities. So all of these illnesses, they are a form of dementia. They all cause memory loss, changes in personality, changes in their personality and functions. So we want to reduce our risk, we want to take care of ourselves, and we want to age with vitality. And we're going to do that when we consider some of the pieces of the puzzle as well. So our physical health and our brain health is really important to how we're going to age, and it's important that we take care of all of parts of us. So can we reduce the risk? We believe so, and some of the research is actually showing that we can reduce our risk of dementia, but there are some things that aren't changeable. So unfortunately, we are the age we are. We can't turn back the clock. And our genetics are what they are as well. So even if you look back through your family history and you see maybe several folks with a form of dementia, or they've got heart disease or cancer, all those things, unfortunately, they're part of our genetic makeup, and we can't change that either, and our family history. But research is telling us that we can adapt our lifestyle to some extent, and it may help us live longer, healthier, without dementia. So what are some things we need to do? We need to think about what's good for our heart is always good for our brain, and what's bad for your heart is usually going to be bad for your brain, okay? Heart and Stroke has done a great job highlighting some of the things that we need to take care of our heart, our cardiovascular system, and all these things are going to benefit our brain as well. So what are some risk factors already for this disease? So age is one. Typically, Alzheimer's disease and its related forms of dementia do approach or attack people that are older than 65. However, we know, and we've met many people that are not quite 65 yet, that may be in their late 40s, early 50s, that are experiencing a form of dementia. Okay, so age is the biggest risk factor. Family history is second. If we especially have a number of family members with a form of dementia, then that increases our risk. It doesn't mean we're going to get it. It just means it increases our risk. Unfortunately, women tend to be twice as often diagnosed with dementia as men do. Cardiovascular disease. So if we have high blood pressure or high cholesterol that we haven't taken care of and it hasn't been treated properly, then that increases our risk of having a stroke, which could lead to a mixed form of dementia or vascular dementia. Diabetes as well. Again, if these things aren't being treated, then it's going to increase our risk. Smoking, and as well as a history of mini strokes. So oftentimes we may not even recognize that we've had a transient ischemic attack or a TIA or a mini stroke. They can be very little blips that happen in our brain, and it may just sort of change our functioning for a very few seconds. So we believe that we can control some risk factors, and we can do that by these four top things. So challenging our brain, which we've got some puzzles that we've done and a couple more to do, making some healthy lifestyle choices, remaining socially active, and protecting our head. So this is a quote by Dr. Anderson. She's a psychologist at the Baycrest Health Center in Toronto, and she says there's no magic activity. It's just daily life. Involve yourself in activities that you're not already an expert at, that are challenging for you and that you enjoy. So when you think about challenging your brain, you can do things simply as if you always comb your hair with your right hand, try and use your left. Or you always brush your teeth with your right hand, try and use your left. So that's kind of simple ways that we can challenge ourselves. As well, it's not necessarily going to learn a new instrument. That's certainly a way to challenge your brain, but perhaps it's learning a new song and not always going back to the ones that you already know. So it's simple things that we can do to challenge ourselves. So here's another couple of pictures. I think for me, I like words, so pictures kind of make me think outside my sort of comfort zone. So what do you see when you look at this picture? How many faces can you see? Okay, so there's a gentleman. Yep, he's got a big nose and a big mustache and a big tam on his hat or head. What else? Do you see something? Okay, so there's also a younger girl, and there's one more face. Can anyone see that last face? Yeah? Yep. Okay, so it's an older woman, and she's actually, well, I'm not sure which way she's looking on the screen, because that's kind of beyond my abilities at the moment. All right. So yes, so there's certainly three faces in that picture. And here's another one. Again, we're looking for some faces. So let's just take a minute to see how many you can find. And I'm not sure how well you can see it, so that might be a bit of a challenge if you're back too far. What do you think? How many? Okay. Okay. So some of the girls at the front are saying they can see between 3 or 5. Can anyone find 7 or 8? And again, it might be just where you're sitting. That's a little bit more challenging. There are actually 8 faces in this picture. And if you came up afterwards, I'll leave it small screen so it might be easier to see. But even if you look just sort of at the top, where the bird is on that side, there's about 4 faces right in that section right there. And then one on the other side looking out. The girl in the middle of the gentleman's ear, and certainly the large face in the middle. It's great. I love hearing the discussion as people try to find them.
Looks like he has his stick across him or something.
Okay. All right. So kind of just simple ways that we can think outside our normal realm of thinking and ways to challenge ourselves. So I'll just move on. So really, things that we can do to stay mentally active is really to stay curious, to read and write, do crosswords and puzzles and Sudoku. All those things are really good for challenging our brain. Attending lectures, providing creative arts, and I mean certainly here at the Pawing Match there's lots of opportunities to learn some different skills, to take part in the different tents as well. Commit to lifelong learning, play some intellectual games. For those of you that are sort of technologically maybe challenged or gifted, either way. For those that are challenged, I really encourage you to sort of access the internet. There's fabulous brain-teasing opportunities there and different sites that you can continue to develop those strengths. Learn a musical instrument. And then lastly, not relying on technology to do all of our thinking. So that's just one piece. So the second piece is that we also need to take care of our bodies, and we can do that by walking. Walking is a really great activity, and so if we walk less than a quarter mile a day, it does increase our risk of Alzheimer's disease. So I just encourage you to spend 30 minutes a day just going for a walk. Exercise your body and brain. Dancing, it's our memory and fitness. So use it or lose it. And I just really encourage those small steps. So even if you think, oh, I really can't get out too far, it's pretty challenging, or I've got some pain or some changes in my body, just to take those small steps, because it really does lead to future strides for future health. I'm not going to spend too much time talking about feeding your brain, because I'm running out of time, but I just want to encourage you to decrease your risk of, or decrease the fat that you do take in, because that does increase our risk of dementia. To eat well, eat lots of fruits and vegetables, whole grains, whole fruits, cold fish, those are all good brain healthy foods. And practice safe stress as well. So try to kind of get your stress under control, ensure that you're kind of doing things to beat that stress, because that can lead to an increased risk of dementia as well. So the third one is to stay socially connected. So especially if you live alone, I think this is one of the bigger challenges, but to make sure that, if you have a friend or someone that is living alone, to give them a call, get them out, because that can certainly help decrease the risk of dementia as well. Connect with family, connect with friends. And lastly is protecting your head. Protecting your head either from falls, if you're a skateboarder or you're a rollerblader or whatever you do for fun. But I think especially as we age, that risk of falls is huge and can lead to many serious consequences, including premature admission to long-term care. So take a look around your home, see if you have those slippery skid mats. Perhaps you need to add some grab bars, and it's my little opportunity to say, don't be so proud, just add them, because if it's going to help you stay on your feet as you're getting in the door, it's far better than a fall. So just be aware of some of those things in your home that you can change as well. And really, that's our four ways that we can live and hopefully age with vitality. So we're going to continue to be intellectually engaged. We're going to choose a really healthy lifestyle, or start to make changes towards that. And again, those small changes, those small strides can lead to huge changes in our future health. We're going to stay socially connected, personally picking up the phone, getting together with friends. And lastly, we're going to protect our heads and our physical bodies.
If you or someone you know could benefit from the services at the Alzheimer Society, or if you'd like to get involved and become a volunteer, please visit your local Alzheimer Society.